Welcome to the ILCM training course Liver Cancer. My name is Appen Kautz and I'm part of the operating committee of the International Liver Cancer Movement, ILCM. Today we focus on staging and grading. It's my pleasure to have Bruno Zangro, an international well-known expert with us, and Michelle Tolle, a UK patient at risk, who have lots of questions. Let's start. Michelle, your first question to Bruno.
Hello, Bruno. I've heard about staging and grading. Could you explain what that means, please?
Hello, Michelle. Yes. At a certain time point, a patient may have liver cancer that consists in a small tumor or in a high tumor burden with metastasis in different organs. And the prognosis and the treatment is absolutely different for those two people. So we divide the patients with liver cancer in stages, meaning that the tumor burden and other factors such as performance status are different in each stage. And for each stage, we can define the prognosis in a more accurate way. And for each stage, we can also recommend specific therapies in a more appropriate way as well. Those are stages.
So what are BCLC stages then?
The BCLC is the classification, the staging system that we used worldwide to classify patients with liver cancer. It includes 5 different stages, and you can see in the slide that they are the very early ones, single tumors smaller than 2 centimeters, BCLC 0, early tumors, any tumor that is single, BCLC-A, intermediate stage when there are multiple tumors, but all of them are within the liver, BCLC-B, advanced stage that includes patients with invasion of the vessels that go to or from the liver, or metastases outside the liver, that's BCLC-C, and then we have a final BCLC-D stage. And these are patients that, irrespective of the tumor burden, they have decompensated liver disease with ascites, as you can see in the slide on the left-hand side, abdominal swelling, or jaundice, you can see on the right-hand side, a yellowish color of the skin, or in the middle, you have hemorrhages. If this happens, the prognosis is based on cirrhosis and no longer on the tumor. And this is why there is a separate stage for these decompensated patients.
Thank you. What does performance status mean?
Performance status means the ability to do the ordinary tasks. So when you have no symptoms related to cancer, you have the best possible performance status. And the different intensities of the symptoms related to cancer that you may have as a patient takes you into different degrees of impaired performance status. And these, we can grade it using scales. And this is important to establish the correct stage. More advanced stages include patients with symptoms related to the cancer. And it's also important when you have to make therapeutic decisions, when you have to decide what treatment is the best.
I have to thank you, dear both. So, and if you, dear audience, are interested to learn more about liver cancer, please go to www.ilcm.global. See you soon.